On this video, we will look at the composition of blood in a greater detail, especially in terms of plasma and red blood cells. Next, I want to say a few words about what blood is made of. Interestingly, it is the only fluid tissue in the body, and we remember it was classified as a special type of connective tissues. So let's have a closer look of what blood is made of. About 55% of the volume of blood is its liquid matrix. This non-living fluid is called plasma. And all other components, the cells, are suspended in it. So let's have a look of those. These cells are known as formed elements of the blood. And there are three types that I want us to talk about. Firstly, about 45% of the volume is red blood cells. These are known as erythrocytes, and often you will notice that I just abbreviate them as RBC. We also have white blood cells, abbreviated as WBC. The proper term to describe these is the leukocytes. And finally, platelets. These play an important role in blood clotting. So we have about or less than 1% of each for the white blood cells and platelets. And I should probably say that there is a little bit of variation in these percentages of the volume for these components of the blood. The number of red blood cells, so our erythrocytes, was about 45% of the whole blood. This is known as our hematocrit. And it varies a little bit between males and females, being typically 47% for males and 42% for the females. But there is also individual variation. Plasma was about 55%. I also want to mention buffy coat, which is this white thin layer that separates red blood cells and plasma layers. It is made of white blood cells and platelets, and these were together less than 1% of the whole blood volume. So, how do we separate blood into these three layers? Well, you may have guessed, the method is spinning the sample in the centrifuge. I also want to show this microscopy image. This is what a typical blood smear would look like. You can see the plasma in between the cells, so this white space, the matrix where everything else is in. And lots of red blood cells, these red dots. And our white blood cells stain dark blue from their nucleus. And they are physically bigger than red blood cells. And finally, platelets. These are small cell fragments that play an important role in blood clotting. Let's look at each of these in a little more detail. First, plasma. It is a yellowish-colored, slightly sticky fluid, and about 90% of plasma is actually water. Remember how we discussed about the importance and properties of water earlier in our courses? I have added a link to a video regarding to this to the end of this video in case you want to revisit this concept. There are a large number of materials that are dissolved in plasma, so we are not going to go through approximately all 100 of them, but just look at the most important ones. First, I have here is proteins. This is the most abundant solute in it and remain in blood as they are not taken up by cells. Most of these proteins originate from the liver where they are produced. A couple important ones that I wanted to mention are albumin, which represents about 60% of all blood plasma proteins. These are carriers, buffers, and play a role in the regulation of osmotic pressure. Another one that I want to mention is globulin. This plays an important role in transportation and immunity. And then we have proteins that play a role in blood clotting. then we have various nutrients, gases, hormones, waste products, and inorganic ions. Let's talk a little more about the formed elements in blood. Most of these originate in red bone marrow as stem cells, but soon specialize to different paths. So the term that we use for this is hematopoiesis. The term poiesis refers to making of something, and the term hemato obviously refers to the blood. These cells have a rather short lifespan, just a couple of days. Therefore, there is a constant production of these going on in the body. Let's talk about red blood cells first. These are known as erythrocytes, as you can see at the heading on the top. So the production of red blood cells would be therefore known as erythropoiesis. So following the same logic as before. If you wish to describe these, they are these biconcave discs. So like a round balloon that has been squashed in the middle, but not quite the full way through. This shape actually is important. Remember how in anatomy and physiology, form and function were always related. So the shape of a red blood cell is optimized for gas transport to hemoglobin, and also so that these cells can optimally still squeeze through the narrow blood vessels. Another interesting thing to note is that there is no nucleus in these cells, so they are called anucleate. How can cell come to be without nucleus? I thought that all cells need a nucleus, right? Well, actually red blood cells start by having one early in their development, but then lose it later. Notice also that there are no cell organelles in these, for example, no mitochondria. If there is no mitochondria in a cell that transports oxygen, it will not end up consuming the oxygen that it is meant to transport. Red blood cells contain hemoglobin, which you might have heard of sometime earlier. In fact, about 97% of the red blood cell's volume, not counting the water, is indeed this hemoglobin. So it must be important. Well, what is the function of hemoglobin? It is, of course, to a large extent, the gas transport. In addition to transporting oxygen from the lungs to the body, hemoglobin also plays a role as pH buffer and transporting carbon dioxide away from tissues to the lungs. And I also want to mention the word hemoglobin itself, that the heme part comes from the red pigment, which actually contains iron, and the globin part of the word refers to the protein that it is bound to. Finally, note from the diagram that each hemoglobin can carry 4 oxygen molecules. I also want to say a few words about the color of the blood, and this has to do with this hemoglobin too. When oxygen is loaded in lungs, these red blood cells would be carrying oxygen, and we talk about oxyhemoglobin. This kind of blood is bright red in color. And then again, when oxygen has unloaded it in tissues, these red blood cells no longer carry oxygen, and they are called deoxyhemoglobin. These have a much darker red color, in making the blood almost slightly bluish. Now, I want to mention just a few words about why smoking is so bad for you. What actually happens can be explained by what we just learned. One of the reasons why it is bad that cigarette smoke contains carbon monoxide. This is colorless, odorless, and tasteless gas. It is very dense, and in case of a carbon monoxide poisoning, where, for example, a fireplace has not been properly put out, it lands to the bottom of the room because of its density. In fact, out of poisoning deaths, about 50% are due to carbon monoxide. So what happens is this. The carbon monoxide takes oxygen's place in the red blood cells' hemoglobin, blocking oxygen from binding to it. Therefore, we end up with this, resulting in impaired oxygen delivery and utilization. Kind of dramatic, huh? I also want to talk a little bit about the production of red blood cells. This was known as erythropoiesis, as we saw earlier. This takes place at the red bone marrow, where they start as stem cells and then specialize further. So, there can be two conditions that we must consider. If there are too few red blood cells, this leads to tissue hypoxia. So tissues are starved for oxygen. And interestingly, if there are too many red blood cells in the blood, this results in increased blood viscosity. So what is important is that there is a balance between red blood cell production and destruction. And this depends on two factors, hormonal and dietary. Let's look at both of these a little bit. In case of hormonal control of blood cell production, one hormone that we want to look at is erythropoietin, which is often more commonly known as EPO. This stimulates red blood cell production. It is released from kidneys in response to low red blood cell numbers or low oxygen levels. Things that can cause these conditions would be iron deficiency, high altitude lung problems, or amount of testosterone. Note that males have more testosterone and more red blood cells. So, can we think of any event where this could be misused? This actually happened in my native country in early 2000s. So although high altitude training is considered as an acceptable conditioning method for a competition, using artificial EPO hormone was widespread practice in cross-country skiing. And of course, the aim of this was to ensure that athletes can carry more oxygen so that they could perform better. This, of course, is not okay. It also comes at the risk of blood clotting, getting a stroke, or even heart failure. So luckily this was caught and stopped, and those who needed to were penalized even retrospectively. Let's talk about another type of control. Control of red blood cells with diet. Amino acids, lipids, and carbohydrates are needed for red blood cell production. And of course, iron too. So, while free iron is toxic, it is necessary for the body and stored in body bound with proteins. So, what happens to red blood cells? Well, they live for about 100 to 120 days, and because they were anucleate, did not have a nucleus. They cannot grow or divide to make new red blood cells themselves. So when red blood cells become too old, they are broken down in components. Some of these, such as iron, can be reused, while others, like heme, are removed by liver, for example. There are a couple of disorders that I want to mention before we wrap up this video. Let's have a look at those. First, let's have a look at anemia. In anemia, the blood has an abnormally low oxygen carrying capacity. This leads to the oxygen levels being too low for supporting normal metabolism. Typically, it is rather a sign of a problem. And the solution to these issues lie in the solving the true condition behind anemia. Some typical symptoms would include tiredness, paleness, difficulty in breathing, and feeling cold. And overall, anemias can be classified in 3 groups based on the cause behind them. These are anemia due to blood loss, anemia due to not enough red blood cells being produced, or too many red blood cells being destroyed. So let's have a look of each of these a little bit. In anemia that results from blood loss, we can typically have 2 major types. One that are due to the rapid blood loss, for example, due to a severe cut. And the approach to treat these would be to replace the blood that has been lost. So blood transfusions are going to be important here. The other option would be chronic loss of blood, which then results in anemia. In these cases, the loss of blood is rather little, but happens consistently over a long time. Some good examples of these would be hemorrhoids or a bleeding ulcer. And really, to treat these, we must address the primary problem, which will then stop the blood loss and rectify the situation. In cases where we do not have enough red blood cells being produced, there can be a few different causes. Firstly, we can have a situation where there is not enough iron taken in diet, or the iron taken in is not properly absorbed. Remember, iron was needed for each of the heme groups of the hemoglobin. So as a result, we would now produce red blood cells that do look like these normal ones that we are used to, but rather appear small and pale in color, and most importantly, unable to transport sufficiently oxygen. We would treat this situation with iron supplements. Other reason for lack of red blood cell production could be issues with vitamin B12. So this can be either intake or absorption of vitamin B12, which then results in issues with the process of where red blood cells are supposed to divide. This would cause red blood cells to grow but fail to divide, resulting in large red blood cells known as macrocytes. So again, sufficient oxygen transport would be compromised. And this can be sometimes a problem, especially for vegetarians. And what we would do could be, for example, vitamin B12 injections or supplements. One more cause for lack of red blood cell production that I want to mention is known as renal anemia. This is often accompanied with renal diseases where kidneys cannot produce enough EPO hormone. And the treatment would be quite simply administering synthetic EPO. Finally, there are many reasons why too many red blood cells may be getting destroyed. And while your textbook discusses quite a few of them, like aplastic anemia where red blood cell bone marrow is destroyed or inhibited due to drugs, chemicals, radiation, or viruses, or hemoglobin abnormalities due to genetic disorders, the one that I want to focus is the sickle cell anemia. So what we are seeing here is a normal red blood cell. See the round shape, slightly squeezed from the middle, giving this biconcave disc shape that we talked about. Well, in a sickle cell anemia instead, the red blood cell would look something like this. You can see the sickle shape of the red blood cell. This is typically due to a mutation in the DNA that codes for the red blood cells. So here you can see normal amino acid order of a red blood cell. And just a small error in the DNA, which then causes one of the bases to be coded wrong, like we see here, this would have a catastrophic effect on the resulting red blood cell's shape, as we see here. And the problem with this is that these sickled red blood cells do a poor job of carrying oxygen and also have a tendency of getting caught and blocking some of the smaller blood vessels. So this would be a problem. Here comes an interesting point though, and this might help you with this week's food for thought exercise. Here is an interesting map showing how sickle cell anemia is especially common amongst African people. Why would this be important? Well, there is something else that is common in Africa. Yes, you may have guessed it, malaria parasites. See how these maps practically almost overlap. So why would this be important? After all, sickle cell anemia was not a good thing. It made you to have a poor oxygen delivery to the tissues and could cause issues with the sickled red blood cells getting caught into small blood vessels. Well, it turns out that having sickled red blood cell may also be beneficial. The malaria parasite actually spreads through, entering red blood cell. But if the red blood cell is sickled shaped, it cannot enter. So having this condition can be almost protective towards malaria. Who would have known? Well, what we normally do for sickle cell anemia is that we treat these conditions with transfusions or chemically preventing the red blood cells from sickling. So, this completes our review of the plasma and red blood cells. In the next video, we will be briefly looking at the white blood cells and platelets. I will see you there.